У часи викликів та великих змін цифрові технології стали надійним союзником медичних працівників, щоб допомагати в лікуванні, щоб уся важлива інформація була під рукою, щоб усе прозоро, швидко і зрозуміло. Цифровізація не лише про зручність, це про кожне життя, врятоване вчасно. У це вірить військовий медик із Херсонщини, який під час складної операції використав Starlink для консультації з хірургом у віддаленому госпіталі. Це знає терапевтка з Тернополя, яка має доступ до медичних даних і може ефективно лікувати людей, що переїхали до міста. Цифровізуємо, щоб медицина була доступною та зручною. Щоб пацієнти не стояли в чергах під кабінетами, щоб оформити документи швидко, щоб і на передовій, і в цивільних містах українці були впевнені, медики роблять усе і навіть більше для порятунку їхнього життя. Цифровізуємо медицину. Будуємо здорову націю.
Давайте поаплодуємо всім, хто присутній тут в залі, тому що всі, хто тут...
Okay, let's give it up for you all, because all of you online, offline, are doing all of that. That's just a little part of the big medicine digitalization. It was unthinkable a while ago. Nowadays you get shelling, power cuts, and we keep doing this thing, moving on. I can see various people in this audience that have met each other during the digitalization. These guys do things on the internet, they digitalize. They're medics, civil society people, and they are on the same page right now. About 10 years ago, it would have been unthinkable. So let's give it up for everyone in here, offline and online. All of this is aired online as well. We welcome online participants too. They say that digitalization will lead to the loss of communication. We're going to lose our soul. We won't speak with each other. We're going to speak through the gadgets, and we're going to lose that thing. But that's not true. That's not true. If something remains inside of us, we still can communicate. In this summit, we're going to discuss our achievements of today and future. And let's start with an example. It's going to be the anthem of this country. I'd like to invite over here a person, a doctor from Chernivtsi, Olena Mandry-Klim, and she will perform the anthem.
Героям слава! Дякую дуже. Олена спеціально приїхала на день з Чернівців, щоб офлайн виконати гімн, а далі онлайн, в тому числі офлайн працювати, я так розумію. Олена, спасибі величезне. Дякую дуже. Дякую. Давайте ще раз поаплодуємо. Це ще не останній сюрприз, який теж буде про передачу того, що ми звикли передавати лише офлайн, а виявляється, можна передати і онлайн. І взагалі сьогодні буде дуже багато розмов, відвертих розмов з запитаннями, з відповідями, з презентаціями. Це така звітна історія, але й не звітна водночас. Це історія комунікації. Ми зустрічаємося в
It's all about communication. We meet together in a new venue. We discuss the achievements of the past. Just a few housekeeping points. You can take photos in here, you can tape all of this, but I'd like for you to share all of this later on. So right now we are in a safe place.
Але от ви бачите, що є укриття так само, в
There
разі
is
чого
also a
ми...
shelter where we can go if need be.
Ну що, пані та панове, я пропоную зараз почати, і у нас дуже...
So let's get started actually.
До нас дуже багато гостей приїхали з-за кордону.
Many guests came to us from
Зараз,
abroad.
для того, щоб розпочати ось цю широку розмову, я хочу запросити на цю сцену, на цю трибуну людину, яка дуже багато зробила зі своєю організацією для того, щоб ми, власне, говорили про ці здобутки, які є сьогодні. Це директор Європейського бюро Всесвітньої організації охорони здоров'я.
We're going to have it from the director of the WHO office, Mr. Kluge. He will come out here. Let's give it up for Mr. Kluge. He is well known to the professional community. So the floor is yours, Hans.
Dear colleagues, dear friends, it's my great honor and pleasure to be once again back in beautiful Ukraine. This is actually my 6th visit since 2022, and I'm profoundly inspired each time I return by the immense resilience of the Ukrainian people. I arrived here in Kiev after field missions to Odessa, Kharkiv, Chuhuiv, Dnipro, and Poltava. And I see my friends from Poltava here in the room. No doubt, your healthcare system has faced a cascade of challenges, challenges unprecedented in the European context since 1945. Navigating these immense challenges for healthcare has not been an easy journey, but the efforts you have undertaken to continue to strengthen, to rebuild your health system are remarkable. And as you will discuss today, digital health is a critical part of this process. Across Europe, we have been witnessing a digital health revolution. Digital tools are reshaping how healthcare is delivered. They are enhancing patient care and patient satisfaction, and they are decreasing the heavy burden on the healthcare workers. But several challenges remain, and maybe the biggest one is equity. Only half of the countries in the region have the policies it takes to improve digital health literacy. Dear friends, this morning we had a long and productive meeting with the Minister of Health, Dr. Viktor Lashko, and it's amazing, despite of all the challenges you face, how much digital health innovations you are implementing. It's a great honor and pleasure from us at the World Health Organization to stand with you to improve health, including digital health in the country. Dear colleagues, our future is digital. The future of health is digital. Digital health offers Ukraine hope and progress at a time when it faces some of the biggest challenges in its history.
Thank you.
Together, let's ensure that everyone, wherever they live, can benefit from digital health. As we say in Ukrainian, Vavkiv bayatis vlis nichaditje.
Дякую, Гансе, дуже. Спасибі. Ганс Клюге, директор Європейського бюро Всесвітньої організації охорони здоров'я.
Thank you very much,
Якщо
Hans
ваша ласка,
Kluge.
скажу одну річ, можливо, і не маю її казати, але колись
I'm going to tell you one thing, if you're in
у
mind.
одній з київських лікарень.
Hans's colleagues visited one of the hospitals in Kiev, and a WHO person spoke with a doctor, and I spoke with the doctor, like, what was the talk about? And he goes like, we could think of everything after 2022, but I would never expect us to talk about digitalization while the work continues. And same talks happen in all countries, in all offices. This time we're going to speak about matching two stories, medicine and digitalization. From the medical community, we're happy to welcome Mikhail Radutsky. He's in charge of Health of Nation, Health Insurance, and Health Services. So I'd like for you to come up to us here representing the medical community.
Зі сторони медицини це дуже голосно. Я думаю, тут в мене
That's an overstatement, I'm afraid. There are other colleagues that are truly medical community in here.
хотів би всіх привітати, особливо наших шановних
I'd like to say hello and welcome to you all. In 2019, the president took office and said that this country has to go digital.
І мені дуже приємно, що саме та сфера, за яку відповідальний я в Верховній Раді.
In the Supreme Council, I'm in charge of that, as well as Viktor Lashko in the government. There are many more people contributing to this. So healthcare does not let the president down, as far as we can see. Most of the health institutions input their records into the database, and NCZU pays for the service. So the entire record that you get in the eHealth is fully in place. And that matters so much to us. It's hard for the country to distribute limited resources we have got for everything, including healthcare. 98 kopecks from every hryvnia we earn today is spent on defense. The remaining resource that we get from our partners, World Bank, IMF, partner country governments, we have to spend it very immaculately. Before 2019, it was something totally different. You've got 500 beds. Nobody cares about the quality of service, about the patients. You would get the money anyway, and nobody cares what you're going to do with it.
Скупість, жадність і, не хотів казати, але я думаю, колегам не переведуть, і жлобство, воно завжди породжує бідність.
Greed always leads to poverty, and we can see whatever is going on in the healthcare sector. I think digitalization in this sector matters so much. Without it, this country would not have been able to pass the law on medical cannabis. We have to keep records of antibiotics, narcotics, medical cannabis. All of that requires an electronic recipe. There is a need for electronic health records. Doctors had to learn to do it, inputting stuff in the system. It took a while, but now they're able to do that. I've been to one hospital in one of the regions of the country, and I spoke with the people working there. Like, if you were told to go back to the paperwork that you used to do, would you do it? They say, no, no way. 5 years ago, the doctors in the same facility were telling me that we are the doctors, we have to treat people instead of putting things in the computer.
Збігти встигли тільки від жарту, що ми повертаємось до старої
But
системи.
now they cannot think of going back to the old ways.
Що ще дала цифровізація? Вона зробила
What else is the benefit of digitalization? The healthcare system is now more resistant to emergencies. Back in the COVID and under the war, it has been able to perform steadily. Under the Affordable Drugs Program, citizens can get their drugs wherever they are in the country. 4.5 million Ukrainians have been able to do so. The committee and the health ministry came up with the basis for the electronic health system and its interaction with other electronic systems and registers, including DIA portal. DIA is a showcase even to the US Congress. I have seen that. I have seen people looking at this thing with a surprise. They have to carry the plastic COVID vaccination certificate. Ukrainians could keep it in their cell phone. So those guys in the US have been surprised to see. You see so many electronic projects in the sector that there is a particular office taking care of that, which is the eHealth office. In that platform, all of the stakeholders can address respective issues. And I really appreciate this platform. What we have seen over the last couple of years is a very telling story. In this country, there is a 5-year concept, thanks to Maria Kurchevich. It took her a lot of time to talk with the Jackson offices, but now you get this 5-year concept for e-health development. Every year, they make a roadmap for digital projects. This year, 142 projects are there. We're waiting for 2D to happen pretty soon. 2D is one of the 142. I'd like to say kudos to Minister Lashko. His leadership has made it happen. Over the last 5 years, that was the only ministry in the committee that had been able to be on the same page. It wasn't like that before. You can see where it's at elsewhere in the ministries and the committees, but this synergy paid off, and I appreciate the minister. He has been able to take care of all that, not just in the digitalization sector. I also would like to say that I appreciate our fellow colleagues in this room, stakeholders, partners, actually friends, the European Office of WHO, the Ukrainian office. When they come to us, they say, if something happens in the healthcare in the country, we are aware of that and we can take care of it. USAID-led program, SafeMed, other stakeholders. But guys, without you, it would not have happened. So we really appreciate this. So you will never regret what has been done here so far. Thank you, Mikhail. He's not the only one from the medical community, and that's true. There will be more speaking about digitalization, giving us success stories from various hospitals. So, from digitalization sector, we're going to have somebody speaking with us online, the Vice Minister of Digital Transformation, Mikhail Fedorov. Hello, everybody. Back in September, this coming September, we're turning 5 years old. We did 90% of what we wanted to in terms of internet coverage, digital skills, and IT sector. There are military projects that have been added and education. We work in 100 projects, DIA Education, Business, City, Brave One, Army of Drones, and so on. We have done the transformation that other countries would do over like 20 years. The right policies and CDTO, which includes other ministries, allows to build their own teams and digitalize various sectors from economic, social domain, army, and education. Digitalization also covers healthcare. Together with the health ministry, we have launched COVID certificates, other online services for millions of people in here. New projects are coming up. You will soon be able to use DIA to register as a patient in the eHealth and choose the family doctor and do a declaration. You don't have to go to the hospital and spend time on that. Through the application, you will modify your data in SOS, input in your new phone number or residency. Nowadays, you have to go to the outpatient clinic or someplace else to do it, but soon, through a few clicks in DIA, you can do it. The health ministry team keeps building on e-services and electronic prescriptions and so on. In the digital ecosystem, any government digital products and services are welcome, and there is no way back. We'll need to keep on building a convenient digital country for everyone.
Давайте подякуємо, поаплодуємо.
Let's give it up for Mikhail.
Я пропоную зараз перейти до конструктивної розмови вже і по критих розібрати все, що вже
So now we're going to get the fun part. Let's see what we have gained in terms of digitalization in healthcare. I'd like to invite up here two people. Deputy Health Minister on Digital Development, Maria Kochevich, Director of Department for eHealth, Dmitry Chernich.
Привіт усім. Ми раді вітати вас сьогодні на
Hello to you all. We're happy to welcome you at the first eHealth Summit. It's a big deal in the eHealth. We can see hundreds of stakeholders in here.
Сьогодні тут присутні представники медичної
You get
спільноти,
people from the medical
представники
community,
влади,
from government institutions, local self-government, CSOs, business community, as well as international partners. The idea is to see what has been achieved and to discuss further plans. It's a good opportunity to do some communication in here that's so valuable in the time of war. We will be able to exchange ideas and inspire each other to implement new projects and changes. eHealth is actively evolving in this country. In spite of the challenges we're facing because of the COVID-19 pandemic and then the war, the healthcare system of this country has been able to stand. Ukraine keeps digitalizing this sector pretty successfully. We are resilient and we are reliable. That's what we have been able to prove. The government should be human-centered in any setting. Today, the local eHealth is a big ecosystem encompassing a number of stakeholders and a lot of information systems, registers, thousands of healthcare facilities, and hundreds of thousands of medics and pharmacists, rehabilitation experts, and millions of residents that trust the government and the system in particular. The digitalization of the healthcare system has been going on over the last 7 years. If you compare this to advanced countries in the world, out there, it took decades to do something like that. We're making progress a lot faster. Prior to the digitalization reform, the entire information about patients would be on paper, hundreds of records, forms, and all. A patient would get services in various institutions, but there was no access to a single medical system. If we think of paying for the services or reports the facilities had to make, all of that was very untransparent and inefficient, bringing about corruption risks. System-wide changes in the sector began with the health reform. If you think back of 2016, back then they passed the first paper, the concept reform of funding for healthcare system. Many people contributed to the cause, which I appreciate. And following that, a number of important papers have been passed. The law on government financial guarantees for health services. In all of these papers, IT technologies and e-services were determined as fundamental for the reform and for the progress in the sector. In 2017, they launched the eHealth. Back then, they chose a model of PPP, public-private partnership, which is still there. That means that the data is stored in the government central component, and the data is inputted through private medical information systems, which helps automate processes in individual facilities. After launching eHealth in 2018, primary healthcare institutions began to join the system, and at that point, the medical guarantees program picked up in the country. Nowadays, there is a lot wider, featuring about 40 packages of health services that the government guarantees to patients. Next year, and actually in 2019, they started the program on reimbursement for drugs. They worked with pharmacies. So in 2019, in this country, they have produced the first electronic recipe. The same year, specialized care facilities joined the system. In 2020, there has been a full-blown launch of electronic medical records. And that allowed us to implement a number of new governmental digital tools, like electronic sick leaves, e-baby electronic certificates. Later on, they passed the concept on developing the e-health and approved an action plan to implement it. Nowadays, the e-health is the largest government IT system in the country, among many countries of Europe. To us and our team, it's been a big ask. We have to administer a system like that. It processes up to 1.7 thousand requests per second. Right now, the eHealth carries data on health of 35 million residents, including the ones who had to leave the country because of the war. The system has seen 3.3 billion electronic medical records, 80 million electronic recipes, 590 million electronic referrals. Every day, 19,000 healthcare facilities work with the system, including some in the private sector. The system carries a number of services allowing to have a single medical record of a patient, an electronic record, and that allows to do better planning, vaccination, procedures, everything else. Through electronic referrals and recipes and declarations, all sorts of medical findings. So you can see the information about the services the patient got, as well as the rehabilitation services that have been provided. In spite of the war, the system keeps getting funded thanks to international partners. The budget of the Medical Guarantees Program for 2024 is 159 billion hryvnia. In order to manage this budget, in order to see how many services have to be bought for the population and how it can be paid for, we have to use the data and the tools of the eHealth. Apart from the eHealth, you get other digital solutions in the sector, and we use those for various things in the sector. We use them in procurement of drugs and medicinal products. Back in the COVID pandemic, they launched a med data system which collects the needs and distributes drugs and medicinal products.
час воєнного стану ми
During the
запустили
martial law, we
систему
have been
e-stock.
able to launch
Це
the
система
e-stock
управління
system,
запасами.
which manages the stock.
Власне, її намагались запустити щонайменше
They tried to
останні
do
5
this
років,
over the
і
last
саме
5
нашій команді
years,
це вдалося.
and our team
Ми
have been
запустили
able to do
пілотні
it.
модулі і
We launched
працюємо
pilot
над тим, аби
modules,
розширити цей
and
функціонал.
we seek to widen the
Більше того,
functions.
цьогоріч команда медичного
Earlier
ринку
this
в
year, the
Україні
team of
вперше
medical
почала
procurement in this
використовувати
country
процеси
has started
закупівель
using
і міжнародну платформу
the
SAP
international
Ariba.
SAP
Це
Ariba
власному
platform for
вийти
procurement.
на світовий ринок постачальників.
So we have been able
Це
to go
більше
to the
8
global
мільйонів
market of
постачальників з
suppliers,
усього
which is
світу.
about 8
І
million
вдалося нам
suppliers across the
також
globe.
зекономити бюджетні кошти у
And we have been
закупівлях.
able to save
До
budget
прикладу,
funds in
цьогоріч
procurement.
економія складає більше
This year, we
190
saved
мільйонів гривень
190
на
million
процеси
hryvnia
закупівель.
in
І однією
procurement.
такою закупівлею, якою ми пишаємося, це є броньовані евакуаційні авто.
We have been able to
Ці
book
інвестування і
evacuation
великі
vehicles and
закупівлі були
procure
придбані
those
в канадського виробника
from the Canadian
за
producer,
відповідну економію.
and we
Були
have been
виготовлені
able
за
to save some
стандартами
funds.
НАТО і
These
передані
vehicles
для
are
потреб
made
Збройних Сил
against
України.
NATO standards and have been
Також
transferred to the
час від
Ukrainian
часу
armed
ми
forces.
впровадили два базові
During the
реєстри.
war,
Це
we
є
have completed two
реєстр
basic
лікарських
registers,
засобів і
the
реєстр
Register of
медичної безпеки.
Medicinal Products
І
and
працюємо
Register of
активно, як
Drugs.
пан Михайло згадував, над системою верифікації з
We're actively
2D-кодуванням.
working on the verification
Фактично, це
system
є
feature and
вимога
2D
директив
coding.
Європейського Союзу,
That's
але
one of the directives of the EU,
протидіяти
the requirements of
фальсифікату
it.
обігу ліків на
This will help
фармацевтичному
us
ринку.
combat
Ми
counterfeit
уклали
medical
меморандум
products in
із
the market.
гравцями ринку.
We made a
Він
memorandum with
буде
the
IT
market
рішенням.
players, and we are coming up with the
Також в
IT
цій сфері
solution.
використовуються і інші інструменти.
We also
У нас
use other
працює
tools in this sector.
система епіднагляду
There is
для
an
обліку
epidemiologic surveillance
захворювань.
system
У нас
to
працює
detect
система
infectious
безперервного
diseases.
професійного
We've
розвитку.
got the
Ми
ongoing
готуємо запуск
professional training
системи
system.
e-кров
We are
для
about to
управління
launch an e-crawl
донорською
system
кров'ю.
to
І
manage
також
donor
зовсім
blood,
нещодавно запустили портал
and we
вакансій
have
для
recently launched a
представників
portal of
закладів
vacancies
охорони
for
здоров'я як
healthcare
зручний
facility
інструмент для
personnel,
добору
which is a
фахівців на
convenient
роботу у
tool
закладах.
allowing to find staff for the facilities.
Реалізовано або перебувають на етапах реалізації.
There are other things in the
10
making. There are 12 projects,
державних реєстрів або систем,
12
які
government
реалізовані в базі
registers
платформи
that are
Дія
based on DIA
Зокрема,
engine.
це такі реєстри, як реєстр
Among them,
дезінфекційних засобів,
you
реєстр
get
продуктів
disinfection register,
пластику, реєстр
plastic
кадрових
recycling
ресурсів
register,
для роботи на
staffing
деокупованих
register.
територіях.
That's the one for operations
І
in the
насправді
deoccupied
цифрові
areas.
рішення
Digital
використовуються в
solutions
різних потребах воєнного часу.
are used to
Сьогодні ми
address various
пам'ятаємо
needs emerging in the
перші
time of
дні
war.
воєнного стану.
When the
Був
martial law
певний
began,
хаос,
there
і
was some kind of
водночас
chaos
було велике
initially,
бажання
but there
багатьох
was a lot
країн
of
світу
willingness of
допомогти
many
людям.
countries to help
До
this
нас
neck of the
почали
woods.
надходити запити
We started
щодо
receiving
медичної
requests for
гуманітарної допомоги,
humanitarian and
і
medical
ми
aid,
зрозуміли, що
and we
потрібно
realized that
систематизувати і
we
впровадити
need to
IT-рішення, яке дозволить
elaborate an
повністю
IT
впорядкувати
solution
той хаос, що
in order to
відбувався.
put things in
Тому
order
ми і
and
в режимі
finish the
воєнного
chaos.
часу
And then in
бачити
the real-time
потребу
mode, we
закладів
would be
охорони
able to see
здоров'я
the needs of
і також
particular healthcare
закуповувати
facilities,
усі
and also
вантажі,
would be
які
able
надходять
to
на
see
територію країни,
what's coming
для
into
того,
the country,
аби моніторити
all
їх
of the
до
consignments,
кінцевого набувача.
and we would
І,
monitor
власне,
them
з
until
березня
they reach the final
2022 року у нас
beneficiary.
побудована
Since March of
система
2022, we have
гуманітарної
built a
допомоги за
system of
e-рішеннями,
humanitarian
і
aid
за понад 2
featuring
роки було
IT solutions.
проадміністровано такої
Over a
допомоги на
couple of
суму
years,
понад
we
200
administered
мільярдів гривень. Це є
the
допомога
aid
30
to the amount of
країн
80
і
million
більш ніж
hryvnia.
60
This
міжнародних
came from many
організацій
countries
та
of the world,
партнерів.
from about 60
Також
international
цифрові
institutions
рішення
and partners.
використовуються і в
Digital
ініціативі
solutions are
United
also used
24.
under United 24
Багато людей
initiative.
зі всього світу донатять
Many
для
people in
нашої
the world
країни
make
і
donations
підтримують
to
нашу
this country,
країну.
supporting
І
it.
з цифровими рішеннями ми вже
Thanks to
закупили
digital solutions, we
понад
have been
200
able to
авто
procure
швидкої
about
допомоги
200
і
ambulance
понад 10
vehicles
тисяч
and about
одиниць
10,000
обладнання і медичних
units of
виробів
equipment
на
and
суму
medicinal
більше ніж 2
products,
мільйони
totaling more
гривень
than
для
2
потреб медичного
billion
закладу.
hryvnia to cover the needs of the healthcare
Розвиток
institutions.
телемедицини в Україні вийшов
Telemedicine
на
is evolving in this country too.
два затверджена стратегія розвитку телемедицини в
They
Україні, а також
approved a strategy for it and also passed
законодавчих змін,
a number of
які
legislative changes
стимулювали зазначений напрям.
to regulate this.
Реалізовано 7 проєктів із
7 projects
використанням
have been implemented
телемедичних
using
платформ
telemedical
на
platforms
загальну суму понад
to the
4
total
мільйони
worth of
доларів.
more than $4 million US.
Ми працюємо над депаперизацією
We
сфери.
also keep
На жаль,
removing
але в
paperwork
медичній
from the
сфері
sector.
міститься
In
дуже
the
багато
healthcare
паперової
sector, you
медичної
get a lot of
інформації.
paperwork to do.
Минулого року ми
Last
провели
year,
аналіз і зрозуміли, що до
we did
сьогодні
the analysis and could
зберігається
see that up to
понад
now,
600 паперових
you get
форм
about
облікової
600 paper
документації
forms
із
and
лікарень.
records of various
Ми
types.
сформували дорожню мапу з
We
депаперизації
made
і вже
a
сьогодні над
roadmap
нею
in
працюємо.
order to
Це наша
crack down on
найважча
that,
робота,
and
що
we're on it.
також на кілька років.
That's
Але
going to
вже
take
є
a few
перші
years, maybe
результати,
several
тому
years,
що
but there have been some
буквально 2
results of
місяці
that.
тому перші
A
30
couple of
форм
months
були
ago, the
скасовані,
first
такі
30
більш
forms
не
have been
використовуються
abolished,
і є зайвими у процесі.
so they are
Водночас
excessive in
інші
the
форми
process.
також розглядаються
Other
і
forms
будуть
are
переведені в
are
електронний
going to be
вигляд
digitalized
для
over
медичних
time.
записів. І також ми розуміємо, що для роботи медичного працівника важливо, щоб було
It's
забезпечено
important
достойне робоче
that
місце.
medics enjoy decent
Тому з центрального
workplaces.
рівня залучаємо ресурси,
So at the central level,
щоб
resources
допомогти
are getting
передати
collected
необхідну техніку в медичні
in order
заклади.
to equip
За останні
healthcare
роки було
facilities
закуплено і передано
adequately.
більше 30
Last
тисяч
year, more than
ноутбуків і
30,000
понад 1
notebooks have been
тисячу
transferred to them, and about
Також
1,000
є
Starlink
потрібні
units.
генератори, аби
Also,
робота
you get
закладу була
generators
безперебійною навіть в умовах
that allow the
відключень.
facilities to work in spite of power
Працюємо
outages.
над транскордонним співробітництвом,
We
над
keep working on the
транскордонним
transboundary
кодуванням.
cooperation and
Наразі
data
ведуться
exchange.
перемовини із
Negotiations are in
Європейською
progress
комісією для
with the
того, щоб
European Commission
Україна отримала
to make sure
доступ
this country
до
could gain access
мережі
to the network
My Health.
My Health.
My Health
UA.
UA.
При впровадженні будь-яких цифрових рішень в сфері
While
охорони здоров'я
implementing
ми
any digital
використовуємо
solutions in the
міжнародні
sector, we
довідники
use
та
international
міжнародні
directories and
стандарти. До
standards.
прикладу, HL7
HL7
Ми
Fire,
також
to name one.
використовуємо принципи GDPR.
We also
Це
use
робить
GDPR
наші системи
principles.
більш
That makes the
інтероперабельними
systems more
і
interoperable,
наближає нас на шляху до
bringing us
євроінтеграції.
closer to
Також не
European
забувати
integration.
про
We also need to remember
інтеграцію всередині країни між
about the
різними
ongoing
системами
integration
та
inside the country
реєстраторами.
among various systems and
Важливим
registers.
пріоритетом і
An
важливим
important
напрямком в
priority
нашій роботі
in
є
what we do
кібербезпека.
is
Ми
cybersecurity.
розуміємо, що ворог є достатньо підступним. Ми розуміємо, що в країні
The
триває
enemy
війна,
has got a lot of
і
tricks
тому
to
особливо
employ. There is an
дбаємо
ongoing
про
war in the
питання
country, so
кіберзахисту.
we take care of
Фактично,
cybersecurity.
за час воєнного стану
Ever
вдалося
since the
ускорити
martial law
сотні
started,
кібератак і
we have been
загроз
able
на наші
to
системи. Ми продовжуємо
stop hundreds
навчання
of cyber
фахівців
attacks on
сфери,
our systems.
продовжуємо
We keep
проводити
training
безпекове
personnel for
тестування
this.
та
We keep doing
імплементувати технічні
security
рішення.
testing. We
І
keep
вже
implementing
зовсім скоро
technical
у сфері
solutions. Pretty
запрацює
soon in the
галузевий
sector,
центр для
there's going to be a
кіберзахисту
sectoral
всіх
cyber
складових
protection
сфери охорони
center
здоров'я.
covering all components
На
of the
сьогодні
healthcare
українці
system.
мають доступ до
Residents
32
today have got
дашбордів
access
Національної
to
служби
32
здоров'я
dashboards
України.
of the
На цих дашбордах
NHS.
вони можуть знайти інформацію
That's
про
where they can
необхідні
find
їм
information
послуги,
about the
про те,
services
де, в
they need.
якому
They
закладі
can
охорони
see which
здоров'я
facility
отримують
offers
медичну послугу.
what kind of
В якій
service,
аптеці можна
which
отримати
pharmacy
необхідний пацієнту
carries
лікарський
particular
засіб.
drugs the patients might
Також
need.
Національна служба здоров'я України
The
отримала
NHS of
нагороду
this country has
Open
been
Data
awarded
Government Awards. Це
with
нагорода
Open
за
Data Government
найвищі
Awards.
стандарти публікації
That's for the highest
інформаційних
standards
сервісів
of
центральних органів
publishing
влади.
open data among all
В
the
нашій
central
сфері працює
government
і
institutions.
національний
In the
кіберцентр.
sector,
У ньому також
there's a national
застосовуються
contact
цифрові
center
рішення.
which
І за
uses
цей час
digital
вдалося
solutions.
опрацювати
So
звернення
far,
та
they have been
надати
able to process
консультації
a lot of
більш
requests
ніж
and offer
3 мільйонам
consultations to more than
українців.
3 million local residents.
І все це стало можливим
All of that has been
завдяки
possible
підтримці
thanks to
наших
support
міжнародних
from
партнерів,
international
завдяки
partners,
залученості громадського суспільства,
thanks to the
бізнесу,
CSO involvement
завдяки
and business
нашим
community,
експертам. І,
experts,
звичайно, це відбулося завдяки вам, наші
and
медичні
it
працівники.
has happened thanks to you all,
І
the
те,
medical
що ми
people, the
разом
medics.
робимо такі речі у час
Together we do all of this
саме
while
це
the work
свідчить
continues,
про
and that clearly
ми
suggests
можемо
that
значно більше, аніж
we can
відразу
do
очікували.
more than someone
Звичайно,
may have
що
expected.
будь-які зміни даються непросто.
Any changes
Звичайно,
require a lot of
що
grind,
зміни
a lot of work.
долаються через виклики, через
You have to go
дискусії,
through
через
challenges,
багато різних
discussions,
думок. Тому що
various jarring
різні.
opinions,
Але
because all of us are
ми
different. But
є
at the same
тоді,
time,
коли маємо
we're
перед собою
united
одні
when
цілі.
we
Тому
can see a
те, що
particular
ми
goal
побудували, це
at the end of
наші
the road.
цілі і наші спільні досягнення.
So these are our goals and joint
І також
achievements. We would like to say that we appreciate you all and
технології,
together
які
we're going to
допомагають
keep
нашим
implementing the
українцям
technologies
бути
that are helping
здоровішими. Дякуємо
people
вам.
in this country be healthier. Thank you.
Дякуємо вам. Марія, Дмитро, спасибі вам величезне.
Thank you guys so
Далеко не
much.
йдіть, бо все ще цікаво
Do
попереду.
not
Та
wander
розмова,
off
про яку казала
because
Марія,
there
вона
is
теж
a
у
lot
нас
more to
буде,
come.
тому що це відкрита розмова з питаннями.
We're
з
going to have an
дискусіями,
open discussion
чисто
featuring
рецептів,
questions,
та це все
discussions, and all. It's
Те,
just
що
a
зараз
great
представили
beginning
Марія
of
Дмитро,
something.
це лише
These guys have told us about something that is on the top of it all.
Позаучі, з лаштунками багато хто говорить, що це взагалі відкрило величезні нові можливості розвитку
But there are
індустрії.
new opportunities now for this digitalization industry, for this sector. There are some new values coming up. Let's watch the video. Not all of you have been able to be here. Let's get the flavor of what the digitalization has been able to offer
eHealth –
in
це
the sector.
національна екосистема цифрових
eHealth is a
послуг в
national
Україні.
ecosystem
Цифровий
of
простір охорони
digitalized
здоров'я
health in this
об'єднує
country.
мільйони пацієнтів.
You
Понад
get millions of
480
patients in
тисяч
it,
медичних та
430,000
фармацевтичних
medical and
працівників
pharmaceutical
щоденно
workers,
працюють з електронними
which work
системами,
every day
навіть
using
системами
electronic
та
tools,
реєстрами даних.
IT systems, and databases. The most popular services are electronic sick leaves. It took about 10 years to make it happen. We have been able to do it through joint work. It's a step towards people. Previously, patients would have to collect a lot of paper records. Now the system makes it a lot more easier. Doctors see the treatment, people get healthier, employers can see the information they need, and people get payouts without hassle. There's also less corruption in the system. Electronic service works when the baby gets born. 2 years ago, they started doing that once the baby is born. That's a very convenient tool here. You don't have to go to multiple institutions collecting paper records. Now, online, you can use 9 administrative services, and you can spend more time with the baby. Under the war, neonatal screening was practiced to cover 21 diseases newborns might have. This allows to detect rare diseases before they manifest, and you can implement treatment in order to let children live a normal life. All of that is automated. The information system behind it is fully integrated with the eHealth. This allows to quickly exchange updates between the neonatal screening centers and offer updates on the results to all doctors in the country. The COVID pandemic has brought about many challenges. In this country, the Health Ministry and NHS, Ministry of Digitalization and Business, have built an infrastructure to enable electronic COVID certificates. We're the first country outside the EU that has been able to do so. We have been recognized, our certificate has been recognized internationally. There are 60 countries, 13 million patients, as not just statistics. It speaks about trust in government service. Over the last 5 years, there has been a program, Affordable Drugs, allowing patients to get free drugs through electronic prescription. You get 500 names of drugs there. More than 4.5 million residents have used it so far. Because of the war, there is a growing number of people injured. There are amputees. Following that, they all are in need of rehabilitation. Multidisciplinary teams are on it, and the entire process is monitored through the eHealth. We use the National Classification of Functioning, and the rehabilitation services are done appropriately. Thanks to eHealth, we can amass medical information about patients, electronic referrals, hospitalization records, immunization, lab testing, diagnostics. All of that is stored reliably, and the patient can retrieve it from any facility. There are certain challenges that doctors are facing. Digitalization is a need, not just a trend. It helps you optimize your work. It allows you to work with the patient better. And it helps you offer more efficient service. To patient, it is a way of getting rid of paperwork that you have to keep at home or across various institutions. It has become a convenience to everybody. You can get services through digital solutions. You can sign up to see a doctor, to get a recipe, or to take counsel with a doctor in a different city. Modern technologies make all of this convenient and accessible. New digital solutions are yet to come in the healthcare sector. In this country, government and businesses are making the digital service market, allowing new services and technologies to appear in this country. We promote new technologies. We switch from manual data collection to machine learning and automated processes, which improves the healthcare system all in all. It improves medical procurement and supplies. It allows to efficiently plan on procurement. You can make savings while purchasing medical equipment and products. So we reduce burden on the national budget. In the war setting, there is scarcity of funds, but there is a team taking care of the e-health, and they still pursue all of the objectives that are out there. Expert and donor support helps us evolve the e-health and its tools and other components. Private and public partnership is something that pays off in developing electronic medical services in the country. For the NHS, it is so important to enable efficient use of funding. All of the funding that we have to procure drugs is based on the data from the eHealth, which allows for transparent funding for healthcare facilities. Centralized solutions, electronic patient records, are stored in a safe place. Interoperability and data quality are good. Licensing allows to work with the eHealth, even if you're a private medical facility. This transition is in progress. Doctors and patients need to understand how to use electronic services in the sector. In the NHS, they have established an academy which can quickly offer all information about the changes happened to the eHealth. Sectoral expert assistant involvement of government and civil experts. Lots of patients get services every day through eHealth. Together we can build digital systems and solutions, allowing medics in the country to find the right ways of improving people's health. Thanks to you, we keep digitalizing things and developing health technologies, which help local residents be healthier. Thank you. Thank you all. With this, I'd like to thank the people, which are a few in this audience, and they keep working all the time, and it's hard for them to experiment. It's not because they don't want to do it. They know that you have to be experimenting at some point. If there is a war, you get a lot of patients, and then you have to think of doing something new, stepping outside your comfort zone. That's pretty hard. I'd like to give it up for everybody in here and everybody watching us online. I'd like to give it up for the doctors and hospital managers. They step outside their comfort zone no matter what.
Це знаєте, як Михайло Радуцький колись сказав давно, що ми мало дякуємо, да? Колись це було, він кілька років тому сказав, а сьогодні сказав...
We
часто
gotta
фразу про те,
appreciate
що
those people,
всі
really.
партнери, які з Заходу до нас приходять,
Eventually,
насправді вже друзі.
all partners that work with us are our friends. Otherwise, you cannot do anything. You cannot do it if you're just a colleague. So people are on it 24/7, and the challenges are very non-standard. Let's look at our partners. Behind each of these brands, there are people, and all of you in here know those people perfectly. These people are within an easy reach. You can call them, you can shoot an email to them. No matter where they are in the world, everybody understands that Ukraine is an investment. It's an experiment. And that's where innovations like this can be implemented in peaceful countries. So it's an ongoing collaboration. It's not a charity. Special thanks to Sweden and the UNDP. They keep in touch with us all the time, doing a lot. I'd like now to turn over to one of the friends. He doesn't need introduction, I guess. Director of the WHO office, representing U.S. Health Mission, Robin Martz.
Давайте запросимо пані Робін. Пані Робін, будь ласка.
Yeah, come up here to us.
Де вам зручно? Просто я знаю, що всі вже іноземці потрохи навіть розуміють українську, вже коли на другий тиждень тут. Просто це неможливо.
Добрий день.
О, я ж казав!
Hello, everyone. I'm Robin Martz from USAID Ukraine, based here in Kyiv. It's nice to see everyone today. It's an honor to be here. On behalf of the United States government and the USAID mission here, I just want to tell you that I am honored to be here, and I want to congratulate all of the organizers on the first occasion of the first eHealth Summit here in Kyiv. What wonderful presentations we've already seen, and the history that we've heard of the transformation of the eHealth system here in Ukraine. Today's summit not only showcases the resilience and ingenuity of Ukraine's health system, but it underscores the progress that has been made to ensure that the system is increasingly digitized. So why is this important? Well, not only does this make it more efficient and transparent, but it also allows it better able to withstand the shocks and rapidly recover from Russia's brutal, unprovoked war, while advancing services for all of the people of Ukraine and the defenders of Ukraine. So since 2016, USAID has proudly supported the establishment and growth of the eHealth system here in Ukraine. And the system is really the largest and busiest public IT system in Ukraine, with more than 3 billion electronic health records from 35 million Ukrainians. Some of the stats we heard from Deputy Minister Karchevich, being used by 19,000 health facilities. And as we heard from Deputy Minister, it's processing 1,700 requests per second. Beyond the immense capacity of the eHealth system, we are also proud of our partnership with the Ministry of Health, the eHealth state-owned enterprise eZdrowie, and the National Health Service of Ukraine. The United States government and USAID remain committed to supporting Ukraine, including its health and its digital health systems, in collaboration with our international development partners. Ukraine's investments to improve transparency and efficiency, strengthen data protection, and enhance the use of digital health tools are critical, not just for the protection of, not just for the well-being of individuals and families, but as Ukraine continues to face the hardships of Russia's war. I want to reiterate that USAID and the United States government stands with Ukraine. We support these efforts that really are vital to ensuring the economic, civic, political, cultural and family life of all Ukrainians. And the last thing I'll say, I don't think should need any translation, and that is Дякую, слава Україні.
Героям слава.
Героям слава.
Дякуємо,
Sorry
Робін
for
Марц. Ключові слова Робін вже говорить українською, і це приємно. Спасибі.
Thank you. I appreciate all of that. Some of the Robin's colleagues and the guys you have seen here, you have seen the brands of institutions. All of those speak for themselves. These people live in 2-3 countries. They do not have much time for their families and loved ones. They spend most of the time with their colleagues and stakeholders down here. I'd like now for you to watch the statements from the people who have joined us online from other countries. They're also contributing to the big digitalization of the health system.
Ukraine is doing the impossible. Fighting a war against Russia, a much larger enemy that doesn't share our values, that doesn't respect human life or international law, and you continue developing your e-health system, for example, to provide better care for your patients today and tomorrow. So Estonia is honored to stand by Ukraine on this challenging road of implementing e-health. We are happy to share our best practices. You can learn from our mistakes, and we can always improve together. But Ukraine has also chosen another road, the road to European family. Estonia joined the European Union in 2004, and our integration was supported by our great friends, like Finland and Sweden, for example. So we are proud to be friend to Ukraine and support your European integration together with our Ministry of Foreign Affairs and SDEV. So we hope to very soon start cross-border exchange of e-prescriptions and patient summaries, and I know that our teams are working on that already. Have a great summit today. Slava Ukraini.
We do not get tired of mentioning that Switzerland is not just honored to support the digital transformation of Ukraine, but also inspired by it. Because Ukraine has never stopped to amaze us with its pioneering digital solutions. Today we are speaking about one such field, the health sector. Through our partners, the World Bank, WHO, but most prominently the Swiss-Ukrainian eGap program, Switzerland is supporting Ukrainians on their e-health journey. Switzerland has already contributed to the e-Maljatko service for newborns, the digitalization of key medical documents, and a central database of the electronic health system, among others. Ahead of us lie even bigger plans, improving healthcare services and health literacy, as well as better linking patients and doctors. All can be achieved faster and more efficiently with digital solutions and the potential of DIA. More than 500,000 babies have been registered through the e-Maljatko. This figure demonstrates better than any words that Ukrainians use and trust e-health services. The digital services are becoming a lifeline for families to carry on when medical staff and hospitals are attacked. Dear participants of the first eHealth Summit, today is an opportunity for us to take one step further on the digital transformation of health in Ukraine. Switzerland is proud to be part of this journey.
Distinguished guests, colleagues, it is truly an honor for me to welcome you today at this eHealth Summit dedicated to advancing the digitalization of healthcare in Ukraine. At UNDP, we strongly believe that digital innovation is not only a tool for modernization, it is actually a lifeline in these challenging times. I want to start and begin by commending the government of Ukraine's remarkable dedication to your reforms, even amidst the hardships and the most difficult times of war. During these times, your unwavering commitment as government to delivering needed reforms demonstrates an extraordinary resilience and vision for a healthier, more connected future for Ukrainians. We're also deeply grateful to the government of Sweden for generously supporting digital transformation in Ukraine. Our cooperation at UNDP with Sweden has been commendable, instrumental in accelerating the transformation of services in many spheres, making them more accessible, inclusive, efficient, and most importantly, people-centered. This event became possible thanks to Sweden's support. At UNDP, we're very proud to be part of this journey. We remain and will continue supporting Ukrainians in this digitalization sphere. We will closely coordinate with the Ministry of Health on the key initiatives to enhancing delivery in healthcare through innovative digital solutions and other initiatives, digitalizing civil registries and digital literacy that ensures that all Ukrainians are aware of the new solutions offered to them in healthcare. Together, we will continue to push boundaries and find new ways to ensure that everyone in Ukraine, men, women, and children, have access to quality healthcare they deserve. Thank you for your attention, and I look forward to the continued collaboration and progress that will emerge from this important summit. Дуже дякую.
On behalf of the German government, the European Union and other donors, GIZ provides support to Ukraine's recovery and reconstruction efforts and to its ambitious reform agenda on the path to become a member of the European Union. GIZ has been engaged in Ukraine's health sector for many years, and we provide support on 3 levels. We provide support to those regions which are most affected by the war. We help to rehabilitate and renovate health centers. We provide medical equipment to those health centers and hospitals which are most in need to provide effective and efficient health service to Ukrainians. Second level support looks at building capacity, help training technicians, for instance, in orthopedics and prosthetics. An example of this work is the recent opening of the Unbroken Prosthetic Center in Lviv, which we are very proud of. The third level of support looks at the legal framework to make e-health services work for all Ukrainians. We're looking at the legal framework for telemedicine and how this can be designed to attract more international partners to become part of this ambitious trajectory. Together with you, we are making services become most efficient and effective in the health sector and make Ukrainians healthier. All the best for the conference, and thank you for having us here as a partner.
Давайте ще раз поаплодуємо всім. Хто є у відео, кого у відео немає, Робін, вам ще раз спасибі величезне.
Robin, thank you very much again. We can make an entire movie out of all of these statements and congratulations. It's a good experience to be shared, and in the wartime we have been able to learn to do a lot of things. The health ministry came up with an interesting story. It's about all healthcare institutions in the country.
Що можна взяти участь в умовному, давайте назвемо його конкурсі, хоча насправді це ніякий не конкурс, це
It's about a competition of a kind, although to me it looks like a roll call for everybody who can have an interest in digital keys, who can do things online and can share their stories. Everybody's going digital anyways. So you're going to see more than 100 institutions, and they applied for this competition from across the country. There's a Center of Medicine, Disaster Medicine in Kharkiv region, Nikolaev Hospital. So it's not only western or central regions of the country. You can see all of them. And that's not an exhaustive list of those going digital. That thing's going to be continued. So let's see who has taken part in this roll call and took the 3 top spots. Maria Korchevich, Deputy Health Minister, you're welcome to come over to us here. It's not about showing you the best of the best. It's just an opportunity to discuss some common cases right here on the stage to see what has been achieved so far. So let's think of the 3 institutions in this country, medical institutions, that are going to be rewarded for what they do. Odessa City Pediatric Outpatient Clinic number 6. Let me see you guys.
Це у вас... Вона важкенька, до речі, якщо що.
Трохи неочікувано, але закономірно. Дякую.
Дякую дуже. Дякую. Бачите, от самовпевнено, але закономірно.
Thank you. All right, good luck with that. Borispol Primary Medical Service Center.
Давайте підтримаємо. Так, ви бачите
Вітаю
сертифікат, та ви
Воно
бачите
важке.
нагороду. Спасибі вам. Так, фоточку, будь ласка.
The certificate
Зробили, є фіксація, так.
and the award. Okay.
І так, це важливо. І зараз я прошу на сцену вийти представника Національної дитячої спеціалізованої
Let's have it from the National Pediatric Ahmedid Hospital.
Сертифікат і почесна нагорода. І світлина.
Вітаю.
Це теж як нагорода, фіксація в пам'яті. Щоб онлайн було все. Хоча можна і роздрукувати собі ще світлину. Знаєте, як колись робили. Спасибі вам величезне. Марія, я хочу, щоб ви зараз подякували, тому що це важливо.
Насправді,
Well, you see, effectively,
що цих нагород і слів подяки варті не лише ці 3 заклади.
these
Цих
awards
нагород
should be going to much more than just the 3 institutions. I
охорони
guess
здоров'я,
thousands of facilities across the country deserve it,
медичних працівників,
and lots of medics, pharmacists, rehabilitation experts as well.
нашої української охорони здоров'я є саме ви. І сьогодні
You
ми
guys
дякуємо
underpin
вам
the
за
Ukrainian
вашу
healthcare
небайдужість.
system.
Ми дякуємо вам
You
за
really
ваші
care, and that's what we
ночі.
appreciate.
Дякуємо за вашу
You may not
активність,
sleep at
адже
nights,
завжди
you
на
keep
всіх
working on,
нових змін стоїте ви.
so you are in the forefront of any
Опановуйте
changes.
першими їх ви. Тому сьогодні ми
You
дякуємо.
pioneer in many ways, and that's so great. We have
для
produced a
ваших
video
учнів.
as a way of
Я
thanking you
запрошую
all.
присутніх також ділитися та поширювати це відео серед ваших колег.
You're welcome to
ваших,
share this video with your
глядачів.
fellow colleagues
Ці
and
слова подяки для наших медиків.
everybody else,
Ми всі у Києві.
because this is an appreciation of what the medics have been able to do and keep doing. The heart of Ukraine medicine is you, the doctors, the medics, nurses, paramedics, military medics, rehab experts and pharmacists, emergency medical care, forensic medicine, and other services. In every village and cities, you are the prime movers of change. You rescue lives, you implement new systems, you adapt to any challenges. In spite of tire, your enthusiasm and selflessness makes digitalization happen. Thank you.
Дякуємо всім, хто причетний, дякуємо всім, хто впроваджує на всіх рівнях.
Thank you all for doing what you're doing across the board.
Тепер час поговорити про те, що буде зроблено.
Now let's see what is yet to be done.
Фінансування планів.
We can think of projects and plans, or maybe even dreams.
Людину, яку часто вже згадували.
Would like to get more about this from Viktor Leshko, the incumbent health minister.
Бажаю всім міцного здоров'я. Дуже радий
I
вітати вас.
wish you all good health, and I'm happy to welcome you in
Я
here.
свою презентацію про майбутнє розпочну зі слів подяки.
I'd like to start with words of thanks before speaking about the future. I'd like to thank Maria for leading change in the digital e-health system. Thanks to her team, NHS, електронне здоров'я DP, медичні закупівлі DP, WHO, USAID-led projects
Допомагають робити зміни.
to keep implementing change, to keep helping implement change.
Працівникам, медикам, які
I'd like to thank all of the medics and everybody else who keep doing their thing no matter what, implementing all of these dreams.
Розпочну свій виступ з 3 слів.
Let me tell you 3 things: accessibility, quality, and
Здавалось би,
free of charge.
але ці 3 слова
These words doesn't seem to be anything special, but that's what our dream is about. That's what we're doing while changing the healthcare system. That's how it should be: affordable, high quality, and free of charge for everybody in this country.
те, що ми робимо, воно вже сьогодні дає результат.
So what we do is paying off.
Нещодавне опитування, яке провели
Recently, the USAID has done opinion sampling, and they could see that locals are happy with the changes happening in the healthcare system. They in particularly speak about digitalization, then patient-centered approach. So we're doing the kinds of things that really help people. They help patients in getting services faster, with better quality, and for free at the expense of medical guarantees program. So we can think of other services which will keep helping us make that progress further on. So we've got a lot to do for the next 10 years or so. I'd like for all of this to happen really fast, but it doesn't work like that. So the team have had me tell you about the things that we're going to be able to implement over the next 3 to 6 months. Electronic solution for medical cannabis, that's one of them. It's about accessibility or affordability. These are the drugs the patients need in case of cancer or certain mental conditions. It is something that's coming up. There is an existing stigma in the country, and it is used against some innovative drugs coming over. And because of the stigma, certain revolutionary decisions have been made, but they have been quite complicated. The team elaborating this electronic solution can say that starting October, there's going to be a system in place allowing an entire traceability of medical cannabis. And that's a cool thing, and that's quite complicated. We toured a lot of countries in Europe and the world. None of them has got something like this. The electronic recipe allows us to say that we're going to be able to track everything down to an individual pharmacy, and we'll be able to see what doctor has prescribed it and what patient is taking this. Next thing, ancillary rehabilitation options, electronic prescription. WHO people and UNICEF people can tell you that Ukraine over the last couple of years has done so much in terms of rehab. It's been like a revolution. Now we've got the actual rehabilitation that is evidence-based. We've got assistive technology offices. So we need to be helping people with extra rehabilitation options, and the system will allow us to connect to the system of the Ministry of Social Policy. So people, once they get the prescription, will go through the process and they will get the medicinal product, helping them integrate back with the system. So that's going to be a stride forward. It's coming up soon. Next thing, medical records from the stationary health service. You're supposed to see some biomaterials. The point is that it's important to us to put all of the results of lab testing into a single system so that all doctors could see it. In these records, there will be treatment teams, so a group of experts at the same time could manage a particular case together. This allows to collect information in one place and make right decisions further on, choosing the right treatment tactics. Next thing, medical findings for adoption. We all are moving to the EU, and we speak about the institutionalization of children's homes. Unfortunately, the war brings about a lot of grief, and many children are left without parents. We gotta cut through the red tape, which would get in the way of bringing children back to families. So this electronic solution, we believe, will help remove the barriers in the adoption processes. They will automatically make with the medical findings in order to make a decision on an adoption. So a family will see if they can adopt a baby or not. So that's going to be a breakthrough, and thanks to all contributing to this. Next thing, it's also a medical finding, but this time it's about the driver's license. So here is the deal. These records are no longer going to be sold to the ones who would like to get the driver's license. It used to be like a chaos, but now there's going to be an electronic way of doing that where everything will be clear. It's a personal responsibility for those who presented their medical findings to get the license. There is no red tape, no bureaucracy, no need to collect a whole lot of records, paper records. Next thing is about medicinal products. The quality and affordability of service depends on availability of particular drugs. If we implement new modules in the e-stock system, then there's a way to monitor online every drug that has been purchased in a centralized way. We need to see where that thing is at in a particular moment in time. Medичні закупівлі company works with one of the health ministry logistical agencies, and they do the complete cycle. They procure things, distribute them, and they monitor all of the drugs that have been purchased under the government program that should be available across respective institutions. So we offer solutions to them so that they could do the job. Next thing is the electronic line for endoprosthetic repair. And those are extremely popular right now. I spoke with the veterans and I can see that there have been issues with that. They would not order as many products as needed. There was no transparency in the line. It was not clear who should pay for that and who should enjoy it for free. This year, we have reassessed the needs. We checked with the health departments, senior traumatologists and orthopedists in the regions, and we say, like, there is a need, we can cover this need 100%. The procurement has been complete. For the next 3 years, we're going to cover this need. Now the e-line allows you to register and see when you're going to be able to get the endoprosthetic repair. That's a classy tool that allows you to enable accessibility and free service. Next thing, new registers. There is a long list of those. I'm showing you the ones that can happen over the next half a year. The rating-based distribution of internships. It's about staffing, so it's not an easy thing to discuss. So those who studied at the expense of the government should end up working in the places where they're most needed. Electronic system allows you to do that without interference from particular people in a particular stage. The data gets inputted, the vacancies as well. People makes a choice. The system can tell you what are the things you can choose from. It took us a while to put this together thanks to partners. In 2024 and 2025, all of that will be happening within the electronic system. Notification about cosmetic products. Why we thought we should do that? Well, we can see that in the market there are some operators that are non-bona fide. They say they sell cosmetic products, but in fact, they sell drugs, medicinal products with an active ingredient, which makes it a drug. So you gotta regulate all of that. So we need this register allowing us to track and monitor everything so that no drugs are going to be sold as cosmetic products. There is a new register of drugs and a new licensed register on medical practice, all coming up soon. Information platform of public health. The war got in the way some, but the law on public health was passed under the martial law. We wanted to launch it ASAP, but failed.
ніщо не зупинить ідею, час якої настав, і нам ця платформа треба.
So we kept working on it. This platform is a conglomeration of all the data, allowing us to analyze the status of health of residents and make managerial decisions, to develop the healthcare system and to highlight some prevention options. That's a classic thing coming up soon. We're going to need analytical centers. Everybody is thinking how to work with the system. At the national level, we have found a way. And finally, there's going to be something we had been thinking about for so long. That's the personal office of the patient. In the digital world, you cannot do without something like that. You may call it whatever, but effectively, in this kind of office, there will be priority services up and running, allowing you to choose the family doctor or change the one you've got. There has been internal migration caused by the war, so that thing is really topical. It allows you to enjoy access to service. In that patient's office, you'll be able to change your phone number without having to go through the hassle of verification, without having to go to your family doctor. So you will do all of that like this. And there will be further developments. It will prompt you to take a drug. It will allow you to do other things. So we keep working on this at the national level with various partners. The idea is to make sure that people here be healthy so that they would choose to stay in their home country, and those who had to leave would choose to come back as soon as possible. Thank you all. I understand that it's going to take some doing, and there are lots of discussions going on, but your team is always capable of delivering. So we might spend a year discussing things, working things out, but then it pays off. It's hard to meet with all the teams at the beginning of the year, showing them a target, a plan of what should be done. You have to set the right priorities and then keep making progress. And that's how it works. Thank you. Keep up the good work. Victor Lashko, thank you. There might be more plans than days of the year. Might be like that. So we spoke about what has been done and will be done. We have had everybody, medical community, people working in medical centers, digitalization people. There are lots of discussions going on at various levels and tiers. People are trying to understand each other's ideas and ways. That's a lengthy process, and maybe through a conference like this, you will be able to get exposed to other solutions, other ways of doing things. You will get a better idea of the plans. Let's go back to what we started with. Many people might say that digitalization of any kind gets in the way of sincerity, something we appreciate about communication. You speak each other in the eye, and sometimes we understand the kinds of things that cannot be expressed in words through the screen. But that is not true, because effectively, if we offer this energy, it remains, it stays there. There are doctors in Nikolaev City working in different hospitals, but they got together in order to promote digitalization. Even through the screen, through the text, you can convey something, some kind of emotion and all that, because it comes straight from your heart. So, hey guys, come over here. Let's give it up for them. These are doctors from different hospitals, from different areas of expertise, and this time they will sing a song to us, which is called For the Sake of Life.
без права на помилку й права на втому, на варті здоров'я, на варті життя.
Це наша робота, та справа не в тому. Ми щиро піклуємось про майбуття.
І руки на пульсі, в буквальному сенсі, для нас важливіших немає речей.
Завжди віддаємо, інакше не можем, усі свої сили заради людей,
Заради життя, заради нас всіх. І знов на червоний молю, щоб я встиг.
молю, щоб змогла і щоб зберегла заради життя,
Бо в нас один кисень на всіх.
За маскою завжди звичайна людина, за білим халатом людське серце є.
і також хворіє, і переживає за кожне із хворих, як за своє. І зранку до ночі тривога і втома за всіх, хто дорослі, і хто ще дитя. На передовій ми червоної зони, швидка допомога заради життя.
Заради життя, заради нас всіх. І знов на червоний молю, щоб я встиг.
Молю, щоб змогла і щоб зберегла заради життя,
Бо в нас один кисень на всіх.
заради життя, заради нас всіх.
І знов на червоний молю, щоб я встиг.
Молю, щоб змогла і щоб зберегла заради життя,
Бо в
нас один кисень на всіх.
заради життя, заради нас всіх. І знов на червоний молю, щоб я встиг.
Молю, щоб змогла і щоб зберегла заради життя,
Бо в нас один кисень на всіх.
Один кисень на всіх, одне майбутнє на всіх, один зв'язок на всіх. Давайте спрощувати логістику, знаходити місточки один до одного, швидше спілкуватися.
So that's the way to make logistics easier, and we can break down the barriers no matter where we are in different hospitals. Digitalization allows us to do this a lot better. You can sing this to your patients. That's gonna be a way to go. They expect doctors to accomplish something every time, so keep doing this online, offline. Thank you, everybody who have been with us in here and online. Thank you for keeping the digitalization going. Thank you. I'll see you around.